Hello everyone, and thank you for joining for this presentation. My name is Samantha Walton, and I will be talking about evaluating preschool-age children's response to the response to intervention model. Beginning with a brief overview of response to intervention model, the RtI is a practice and structures which facilitate need-based interventions for children. These models are typically federally funded, and they contain multi-level and tier approaches to academic learning, including service delivery approaches with increasing intensity-based interventions, which are based on data-based choices and analysis. The tiers of RtI are 3 tiers, beginning at the first tier, which is core classroom instruction. The second tier is targeted small group instruction. The third tier is intensive individual intervention. The first tier of the core classroom instruction typically consists of academics that are school-wide and that are targeted to all learners across the board. So this includes all learners in all classrooms without any specified learning interventions. Additionally, the first tier typically has all students in their grade level working as one classroom academically to achieve grade level appropriate goals. In Tier 2, small groups are formed with students that may fall behind other classmates in the classroom. Teachers may provide different interventions for these children that have academic needs, but not one-on-one approaches at this point. At this point, screening measures may have been taken to evaluate students that are falling behind their classmates and may have had repeated academic failures. Tier 3 is the highest level of intervention in the RtI model. This includes individual intervention, which is typically a one-on-one approach. At this point, students have fallen behind academically by perhaps 1 or 2 years. At this tier in RtI, students have reached the highest amount of intervention they can receive in the RtI model. Moving forward, RtI also includes least restrictive environment approaches, evidence-based practices, data-based response interventions, and problem-solving models, which is individualized programming for students decided by school professionals. Some of the roots of RtI begin with IDEA. And in IDEA, there are 6 key principles defined by Burns and Harris. Number 1 is parental participation. If parents don't participate or consent to services, then schools cannot ethically give children academic support. Number 2 is zero reject. This means that a child can't be turned away from education because educators don't know how to educate them or that they can't be taught. All children have a right to public education. Number 3, protection and evaluation. Evaluations must be given by trained professionals that are knowledgeable in the areas they are evaluating. It would be unethical for those who are not trained in specific areas to give tests or assessments or evaluations in those areas that they are not trained on. Number 4, free appropriate public education. Number 5, a least restrictive environment. Number 6, procedural safeguard. These safeguards allow for parents and other staff to be involved and to have integrity during any legal, educational, or anything that involves a student's academic learning environment, to have integrity in the procedures that are being implemented, and that any reviews or disagreements can be mediated and appropriately handled with integrity. Typical settings usually include federally funded classrooms. School psychologists and school professionals can implement and oversee RtI implementation. And as levels of intervention increase, the intensity of interventions increase. Typically, RtI do happen in elementary schools and above. Using RtI in preschools can allow for preschool-aged children to get a head start in academics if they are struggling. This can also help aid in learning about specific learning disorder in preschool-aged children as they prepare to begin elementary, middle, and high school. In academic settings, RtI and specific learning disorders appear as lower levels of academic achievement, low levels of learning, and low rates of learning. Well, in preschool, it may look a little differently because the scoring is different. However, the implication of allowing preschool children to have RtI implementations and models used in their schooling may help early learners to be more successful academically as they move through elementary, middle, and high school. The purposes of RtI are to give appropriate interventions, and a common misconception is that students with learning disabilities do better overall in inclusion settings. This is not always the case, as higher intensive one-on-one learning may make the way for children to be able to be in a inclusion setting. But initially, having that tier 1 may not be sufficient enough for a child to learn efficiently and appropriately at first. Using response to intervention models in classrooms as an overarching intervention model can aid in allowing learners to perform better overall by providing appropriate levels of interventions. Because RtI has different tiers of learning based on individual learning needs, the sliding scale essentially of interventions are very appropriate for all learners based on their level of need. In other words, as intervention needs increase, the level of responding will indicate how much intervention a child needs. There seem to be many parallels between response to intervention models in ABA or applied behavior analysis interventions, such as restrictive environments and data-based decision-making. Even though both models are not typically used in preschool settings, preschool children may respond very well to these models, considering they are data-based and evidence-based, which support all types of learning disabilities and can aid all types of learners in academic progress. And again, even though preschool children and academic scores may be different than elementary, middle, and high school, early intervention tools and implementation of RtI may very much benefit early learners in a way that's evidence-based and data-based. So if a child is responding inappropriately to preschool academics or preschool curriculum, then implementing an RtI model early may very well save a child from further academic failure, which may be unethical to allow a child to fail repeatedly in a scenario which may be able to be ameliorated. There are 5 major evaluations of RtI which can be considered. Specific learning disorder maintenance and identification requirements should be strengthened for an RtI model to be implemented efficiently. Identification of specific learning disorders should not solely be based on ability achievement gaps or non-response to interventions. Identifying psychological processing, strengths and weaknesses result in continuity in all practices pertaining to RtI. RtI can support in preventing learning problems, but specific learning disorders should be highly individualized programming and not just more intensive programming as the tier level suggests. Lastly, neuropsychological and cognitive assessments should be used for SLD or specific learning disorder identification and intervention purposes. Some of the ethical considerations of RtI have been mentioned, but to reiterate, repeated academic failures may be an ethical consideration for people to consider. For example, if a child struggles and is identified after a few academic assignments, implementing RtI earlier would seem to be a more ethical choice than to wait for repeated failures. A second ethical consideration would be parental consent. Under IDEA, parental participation is mandated. However, it also must be consented. Cultural applications of RtI begin with communication. Communication must be in a way that parents can understand. RtI is not only used in the United States, but also in provinces in Canada. There are some practical tips for staff to teach English learners and others from culturally and linguistically diverse groups. Some of these tips include awareness of the differences between native English-speaking learners and English learning students. And in addition, there should be a commitment to provide opportunity to learn for all learners. Another practical tip would be the provision of quality English language teaching. Again, providing opportunities to learn English so that children can become proficient. Lastly, core instruction. Quality instructional design to facilitate English learners' needs. Because the service delivery approach and the positive outcomes that comes with it, it may become more common for schools to have one-on-one practitioners such as paraprofessionals to implement evidence-based programs, and also to start at an earlier age. For English learners, there are many ways to implement culturally appropriate services, such as defined purposes in lessons, models and demonstrations, interactions with peers, guided instruction, focusing on language, and culturally responsible curriculum. Some concluding statements are that starting from a preschool age may elicit better responses earlier and can fade out intensive intervention as learners progress academically. Culturally competent staff must be responsible for learning and implementing RtI in the context of English learners. An ethical consideration for supporting progress by early intervention practices are crucial for the efficiency of implementing RtI.